Good afternoon, Council President Katz and council members. I will say both Dr. Stoddard and I do have a hard stop at 2:30 as we are meeting with representatives from the independent schools in the area this afternoon to talk about policies related to reopening in their space and an opportunity to hear from them. So I will try to keep my remarks brief and succinct to allow for questions. In terms of updates for you all, uh, there has been an increase. If you paid attention to the state numbers, there's been a steady increase in the numbers across the state, particularly in the Baltimore metropolitan area. Over the pandemic, for many of those weeks, the National Capital Region attributed 50% over 50% of the cases on a daily basis. That has changed, and now the National Capital Region accounts for 30 to 35% of cases on a daily basis, and the remainder are coming particularly from BMA and other areas. For example, the Ocean City area in the Eastern Shore part of the state. Of particular note, there has been an increase in the number of young people, particularly 20 to 29 and 10 to 19. And there have been demonstrated outbreaks of cases related to restaurants and bars, as well as a number of sporting events, including youth sports. I believe there was a lacrosse tournament where there was a number of cases associated with that, etc. Now, on a local level, our numbers, as we've talked about over the last couple of weeks, have plateaued in that 70 to 80 range, with the slightest uptick over the last 21 days when we stretch it out over a 3-week period. We've not seen a commensurate uptick in our cases as have in other areas, and not a huge increase in the utilization of our healthcare system. However, we are alarmed because, as we said, the numbers are increasing at the state level, and we have noticed an increase in cases in the District of Columbia as well as in parts of Virginia. In fact, the governor of Virginia enacted or rolled back provisions for, I think, the Hampton Roads, Norfolk area yesterday, from phase 3 to phase 2. Now, I set that stage to say that we are looking at strategies and ideas, and reevaluating where we stand in terms of what we have reopened, and in terms of potential things that we may need to curb or change to prevent us from seeing an uptick in cases similar to what's being seen across the state and across the country, and certainly potentially adopting a more aggressive strategy in terms of bringing us down and breaking us from the plateau. So we have had conversations with our colleagues throughout the National Capital Region to discuss what, if any, actions we need to take as a jurisdiction as well as a region to implement strategies to do just what I mentioned. So we are thinking about those strategies, everything from, potentially looking at hours of services that we have available, how we would implement potentially a travel restriction strategy. And I know that there have been a host of folks sending emails regarding extending our reopening strategy, whether it relates to swimming pools or capacity of events. We're not in a place to do that, honestly, right now. And I think most of our conversations are looking at, as opposed to moving forward and adding provisions to that, it's what do we potentially need to keep in place or adjust to make sure our numbers don't go in other directions. Now, we will continue to look at if there are unique niche opportunities to provide waivers for events, but as far as any changes to our global countywide policies, we are not making or recommending any adjustments to those policies at the moment. Now, I want to also, I will share it with you all because I'm not as tech savvy using the Zoom platform, but we did provide an updated evaluation of numbers that I had shown you all before, breaking down the test volume as well as the test positivity by race and ethnicity. And we do have updated information. The previous information that I shared with you all only looked at or only shared the July numbers for the Latino community and showed significant improvements in test positivity. Those gains hold, and also the trends that we noticed were improvements of test positivity for other racial and ethnic categories, both overall in the county as well as by those top 10 zip codes. It's important to note also that the trends that were identified then showing that overall the Latino community had more tests run in comparison to others, continues to hold through July as well. And so I will share that document with you all offline. But suffice to say, the numbers have improved. And when we look at things, for example, we're seeing an overall test positivity for the Latino community in July of 2.5 compared to 1.3 for non-Hispanic Asian, 2.5 for non-Hispanic Black, and 1.3 for non-Hispanic White. We have continued to expand our testing provisions. We have cleared and are going to be training approximately, the goal is ultimately over 250, but the first wave of county employees who will assist us in supporting the standing up of our current test sites to 5 days a week. And they were cleared late yesterday, and we will begin training them this week and early next week to do just that. So please stay tuned on the dates when those will go live. Additionally, the state has made an announcement, at least to their nursing homes, that, as you know, they have been covering the testing for those sites for the last several months, and from my understanding, plan to do so until mid-August. As you may recall from some of our previous conversations, we have been working with the nursing homes and assisted living facilities to discuss to be able to provide additional testing to those facilities. And in some cases, we've already provided testing to assisted living facilities. And we are continuing those partnerships and conversations to be able to support that once the state options and support goes away. We do have a number of new test sites that are coming online. We have engaged a number of churches, and those church sites, these are part of our online scheduling platform. Will be going live on weekends to provide testing during weekend hours. Additionally, Silver Spring will start tomorrow doing a standing Thursday testing event for the next month. And we also prioritize setting up a site this week in the 20906 zip code, again, to get those percentages up in comparison to the other high volume zip codes. And that testing will be at the Mid-County Rec Center on Friday morning and early afternoon. Couple things I want to highlight. Also, the ready responders have gone live. They've tested over 70 individuals, over 40 different families, and that continues to grow as folks get more familiar with that resource. The CDC team that was here, their deployment has ended, created a fantastic report, both qualitative and quantitative, providing insights in terms of our response in areas where we can improve, and to talk about the efficacy of the response so far in terms of breaking down the demographic and surveillance data. Once I have that report in hand, we'll be glad to share that with you all to provide more insights in terms of our next steps and also reviewing what we've done so far. The last thing I want to highlight is the contact tracing piece. And again, there's an individual on your staff, Naeem, I believe, who is serving as the point coordinator, who we provided all of this documentation to, and I assume they will be working to share that information with you all. Additionally, a lot of this information that was requested is a part of an internal dashboard that will work to make sure that you all have access to. I think the county staff are taking care of that. And so the point in terms of contact tracing, just to give you updates from the week of the 14th through the 20th, the median time between first contact and successful interview was 45 hours and 26 hours median time for a contact interview. Now, for those cases that we were able to reach within 48 hours on a first call attempt, that was 97% of those. 78% were able to successfully complete an interview. 100% of them named contacts, and 93% of those contacts were a first call attempt was successful within 48 hours of them entering into the COVID link system. And so we continue to work with the state. As a reminder, this is through the COVID link state system to try to tease out more information to be able to guide our steps as a locality, but also provide more information to you all as Board of Health. I will stop there in the interest of time. I don't know if Dr. Stoddard will go next, but happy to answer questions at any point.
Thank you. I am going to ask Dr. Stoddard to go next because he too has to leave the same as you do. So, Dr. Stoddard, please.
Good afternoon. Thank you for having me. I do want to add one comment, and I heard this on the news yesterday. So for context, in Miami-Dade County, the 48-hour checkpoint is 18% for contact tracing, to give you a comparison of where we are relative to another hotspot in the country. I don't need, you don't need to be a mathematician to understand how terribly different that is and how problematic that is. Couple points. I do want to give a quick update on the fire that occurred in Silver Spring on Monday evening about 7 o'clock. It was on Carroll Avenue. There were 12 families displaced, and by our total count, it was roughly 60 people who were displaced by that event. I want to give an update on the services that we offered them yesterday and continue to offer them today, because I think they highlight exactly what we're dealing with during COVID and also, how we're working to address the issue. So we had, as of yesterday, we had talked to 10 of the 12 families. Those 2 we were working to reach out to. To those families, we offered them COVID-19 testing via the ready responders from noon until 7:30 yesterday. We did an intensive health screening of all the adults and children. We had initial human services screening for all of the families that we could reach out to. The crisis center was on site to provide mental health support. And there was one couple who was showing some symptoms consistent with COVID-19 that we did transport to the quarantine hotel and are providing them with more long-term and intensive support. We had 6 staff members from DHS who were Spanish speakers on site working with those families. And Red Cross is continuing to provide them with meal support to their rooms, as well as snacks in between. We have engaged, there was actually a meeting today, it probably still ongoing right now, with the Long Branch partners, the nonprofit community in the area. These are all lessons learned after the Arliss Street explosion that we, really modified our process to really make sure that we're integrating with the nonprofit community and making sure we provide more holistic social service support system to those impacted. And so obviously I just want to say thank you to HHS, Emergency Management, the Test Center, Latino Health Initiative, Public Health, the Ready Responders, Red Cross, and the Mass Care team for all of that work. For other more COVID-19 specific updates, I want to provide a PPE update because I know Council Member Reamer asked a question this morning about PPE. We did have I don't want to call it a pause so much as we had given out like a 4 to 8 week supply of resources to many of our assisted living facilities and nursing homes, so we were not doing them for a couple weeks. We began again on this week to continue to provide additional supplies. They actually should be good into August. I think we gave them a 4 week supply on July the 12th, and so they should have resources, but we are restarting resource deliveries this week anyway. That was a planned ability to have us, catch up with our warehousing and things like that. So they are rolling back out this week, and that was, obviously started on Monday again. We had our Community Recovery Advisory Group meeting yesterday, which is obviously as a reminder of 50 representatives of our diverse community across Montgomery County, with representation from, all of our demographic groups, our faith community, our nonprofits across the county. They provided us great feedback. While the goal was to apply a racial equity and inclusion lens to the work that we've been doing, particularly as it relates to the eviction prevention appropriation that you all approved yesterday, talking about the process for how we're going to market and advertise to our diverse communities in Montgomery County, how we're going to ensure that the distribution of those resources is focused on our most vulnerable populations. How do we ensure that people are aware of the resources, and how do we make sure that the resources get into the hands of people as most? And so we got a lot of tremendous feedback. Actually, we're going to hopefully have a meeting today to discuss that feedback and how we're going to actually utilize that feedback to modify our strategy moving forward. Board of Educations, we've had several conversations with the Board of Educations in preparation for the election in November. Their concern is we are right now we're concerned we're only going to have about 1/3 of the election judges that we would have in a normal election year of this size. That's obviously a huge challenge, and there are also the other challenges associated with how do we make polling locations safe? How do we, where do we need to install plexiglass, PPE, all of those things as well. And so there's a lot to do to plan on that side. I just wanted to provide that we are working with them very closely on that. Department of General Services has already reached out to the Board of Elections to make sure that, we're providing them with the resources that they need, identifying what those resources are, et cetera. I'll have more to update on that as that continues to work. We talked about the staffing surge. As of this morning, we had provided 120 additional staff from county government to HHS to integrate into the testing mechanism. That is not including the 25 or so that we've identified for expanding the call taking, and so that is provided as well. We're continuing to recruit additional, and where necessary, we will become more prescriptive in how we do that. But I just wanted to give that update to say that we have acquired the vast number of volunteers from across the county government to address the testing sites, and that will continue to ramp up as we move forward. And then finally, I want to touch on the enforcement and education piece. We are adding additional inspectors from other agencies, DHCA, DPS, and others. I know you all saw the press release where we are going to do some more enforcement on construction sites. We know that those are particularly vulnerable residents who, for whom we have seen issues across the county about face covering and distancing requirements on construction sites. They've been deemed an essential activity from the beginning by the governor. That does not in any way relieve them of the responsibility of protecting the public and their staff particularly. And so we're going to do some more enforcement in that arena to ensure that those workers are protected. One thing I do want to touch on is this issue of live performances. This has become an increasingly area of focus. Couple things on live performances. First off, we had some real conversations about what about live performances was actually not permitted by the state. So, and to be clear, this is a state order, not a local one in this case. The issue around live performances is it focuses on the audience, and so it may seem simple to say what an audience may make sense to us, but we've gotten questions about, for example, if you're at a restaurant and someone starts playing a saxophone tangential to you being at that restaurant, are you an audience at that point? You didn't come to the place to listen to the saxophonist, for example, but it's background music. And so there has been some questions on, interpretation of exactly what defines a live audience and what does not. If you had, for example, a DJ playing in the background of a food distribution event, is that a live performance? And so obviously there's some pretty clear sides where yes, that's a performance, no, that's not, but there's a whole lot of in between where there's some interpretation that's had to go on legally. I would also add, and this is important to understand, even as we ramp up the number of inspectors and people out there, we will never be able to be in all places at all times. And so we are still responding to hundreds of complaints that are filed every week through Health and Human Services, 311 and other means, and we are responding to them as quickly as we possibly can. But at this point, we're not in a position to be at every location, every restaurant, every activity that's happening in the public. And so, where we're not aware of certain things, I'm quite confident there have been live performances and will continue to be live performances that we aren't aware of. When complaints come in or when things are brought to us, we certainly have to enforce the state regulation as well as our local ordinances, and we will continue to do that. But obviously, part of my saying this here is to have it be clear that live performances, those with an audience, are clear violations of the state orders, and as such, when we become aware of them, we absolutely have to make those businesses aware that those are not permitted. Again, we're enforcing the state code there, not to say that we're agreeing or disagreeing with it, but where there are challenges, that's certainly what we're enforcing. So I'll stop there.
Thank you. And I'm going to turn to my colleagues, but just so I'm clear, Dr. Gales, you said on the swimming issue for the lap lanes specifically, you're saying at this point that you are not changing anything? I don't want to put words in your mouth, but are you saying at this point we're not changing anything?
No, we're not changing any of the guidelines. Again, I know that I've received hundreds of letters from families. I think you all have been CC'd on those related to specific pools. I think folks have to understand is, again, that the policies that we put into place are for the entire county and not just for one particular group. And so when putting those policies in place, we have to take into consideration everyone. Now, I know that there are some competitive teams. Again, we can take a look and see if there's opportunities for waivers for specific activities. But the policy that we have in place is actually consistent with our peer jurisdictions, such as Prince George's and Baltimore City, and in fact is more open than DC. DC doesn't allow swimming, period, in those types of pools. So at this point, particularly given where we stand in terms of conversations about increasing numbers, we're not recommending any large or any change to the county policy overall.
All right, and to the point that you said about waivers, if someone was looking for a waiver, they would send it to you? How does that work?
So we received some input from some of the spaces, and what I'll say is this: we'll have our licensing and regulatory team take a look at it. Again, if it's safe, and again, the larger question is much like we talk about the conversation with schools, is there's lots of great, for example, MCPS, I'm not picking with them, they put together great policies. Like they've got great plans in terms of how to keep kids safe when they get there. We just are not at a point from a community standpoint where we have the numbers at a lower place that we would feel safe that even with those provisions in place that we would minimize and mitigate transmission. So we'll take a look. It's not a guarantee to say that it'll happen, but our team will take a look at it. I think we do have at least one group has sent a proposal in, and the L&R team is taking a look at it.
Okay.
I want to add one quick point to this. Sorry. We've seen several proposals using the rationale of this is what they allow in other parts of the state or other parts of the country. That, generally speaking, is not a compelling argument for the safety of said activity, given that many of those other locations have exploding case numbers. And so I'm not sure that, if you could make the argument of something being safe or not on its merits, that's a totally different story. But utilizing the rationale of what they allow in other states and other counties where their numbers are exploding is, to be clear, is not a compelling argument for us.
Okay. And can you give us thank you. And can you give us any update on where we are with Leisure World's testing?
Sure. So the team actually did a site visit with, we had our exchange. They did a site visit with them. If today is Wednesday, I believe that was Monday afternoon. It was Monday afternoon or yesterday morning to move forward with that. So that is in the works. We're able to connect. And I think the question is just in terms of who will administer the test. But the site visit has been completed. I think the loop has been closed, and that should hopefully be rolled out within the next week at the latest.
Sounds great. Thank you very much. And with that, I'm doing the 5-minute rule, and I live by the 5-minute rule too. I want all my colleagues to know that. I wrote down the time for me too. And the first person to speak is Councilmember Ream.
Thank you. Good report. I think a lot has happened over the last few weeks. I was just so happy to see the 250, FTE program rolling out and, really staffing up all of the centers. It's good news. I'm not going to ask for a response on this, but I am getting a lot of inquiries now about turnaround time on testing. And I know that, there's a lot of issues and people don't know necessarily whether the tests that they have taken, what might be factors that would make it one that would turn around faster or turn around slower. But I'll just say, anything you can do to ensure a rapid turnaround of test results, 48 hours or less, I think would be very much appreciated in the community. I know you know better than all of us why that is important. Actually, let me ask, is there anything we can do or that that can be done to ensure the most rapid turnaround? And then I do have another question, so please, if you can keep your response as brief as possible.
Sure, I'll be very brief and easy. So we actually don't control the turnaround time with the labs. It's a process issue. The private labs are experiencing delays. I think that has been corrected over the last week based upon the way the results I'm seeing in the system, how quickly they're being reported. So this is simply, it's based on capacity, and they're getting slammed. I mean, we've seen record cases in these other jurisdictions. Now, as it relates to the local laboratory, we have been working with them to update their software and make sure that that has been corrected. From my understanding, that has improved for the overwhelming majority, but there continue to be folks who there are some delays in getting them. And I would say 99.9% of those, actually I would say all of those are negative results. And so we've just got to continue to stay on top of that and improve, because we share your concern about getting it out quickly.
Okay, thank you. All right. The health regulation that the council enacted as Board of Health, one of the provisions was to ask you to take the plan that you did give to us, and thank you, because it was an impressive document, as Councilmember Albornoz has said. We wanted to go further and have a written strategy around schools and employers. I'll just read the text. It says, the executive must submit a full and detailed COVID-19 response plan, including testing and contact tracing strategy for schools, employers, employees in various sectors, and vulnerable communities to the council by July 28th. It must detail the relationship between testing, tracing, and isolating. I know you weren't able to provide it yesterday. When can we expect that kind of next iteration that's going to go further and a little deeper than the last plan?
Sure. Well, one of the documents we've actually provided to you back in June related to contact tracing and the strategy related to that. So we could go back and take that report and update it with the testing strategy, but that you do have some documentation that gives insights to that. And also part of that is the school system is fluid right now, obviously, as we're trying to work with them and work with the independent schools. So I think some of the information you have already, we're actively trying to address these issues around. So testing is important for the schools. We're trying to work through the strategy now in terms of how they're going to reopen. And as it relates to the businesses, we do have a good amount of those working relationships laid in terms of reaching out with those large venues. So if you can give us some time to put it, take that and translate it onto paper, that'd be great. I'm sorry that wasn't available yesterday, but we can get that to you within the next week.
Understood, and you're right. The school situation has changed since probably 3 weeks ago. But with employers, I think the question is: are there sectors like the restaurant sector, for example, where we could have a targeted strategy with restaurant employers, to help them understand how to get their employees tested, when we think they ought to have them tested, and get the information into their employees' hands about what testing opportunities, just as an example, to kind of take some of those frontline sectors and develop partnerships with the sectors themselves. I did mention that to the MCEDC, and they would be willing to work on that with us as well. Okay, so we'll get a next version of the plan that you've given us, and it'll cover some of the additional areas. One of the keys is that. Am I done, Sydney? Are we done? Okay.
You're done.
Thank you.
Thanks. We'll find out a key. You'll keep us hanging for the key for next time. Councilmember Rice, please.
Thank you very much. I'm going to talk fast. So Dr. Gales, when it comes to schools, and I appreciate you meeting with the independent schools, both you and Dr. Stoddard, because that's really important, because we're hearing so much in chatter around inconsistencies amongst what private schools are saying they're going to be doing in the fall and what our public schools are doing. And so folks are wondering how in the world that's possible if folks are held to the same standard. So I really appreciate that moving forward. So that's not even my question. That's just a thank you. When it comes to, however, us looking at schools reopening, and I've had this question from parents as well as teachers, will something encompass a robust testing model similar to what we have in terms of we require now vaccinations for our children before they come back to school? But are we even doing a baseline in terms of, or has that been a conversation? I'm just curious, because that's what folks are asking me. Has there been a baseline in terms of conversation around robust testing, not only for employees, but also for students?
So I'll talk really quickly too and try to get this done so we have more time. So Councilmember Raymer, yes, we will get that report to you. And I don't know what the key is, but we'll anticipate and try to answer it. Councilmember Rice, as part of the strategy related to the schools, those are all being discussed, because I think everybody is trying to figure out what's the best practice and how to do this. These are not easy decisions. And to folks watching at home, no one wants to close them. No one wants to rush to reopen them. We're just trying to base, when we look, there's anecdotal evidence. I think there was a private school actually in Houston who opened last Monday. And by Friday, there were 5 COVID cases amongst kids and staff, and who knows how many else after doing investigation. So we're trying to balance this and do it safely. We want kids to have the most advantageous educational opportunities, but we want to make sure they are in an environment where they do it safely. So I can attest to you that all of the things that you mentioned have been discussed on a local level as well as a state level. I can't speak for the federal level, but we are trying to figure out what's the best mix of those to be able to do it safely.
Thank you very much. And I yield my time, Mr. President.
Thank you. It pays to be an auctioneer. I'm just telling you. Councilmember Joando, please.
25, 35. Okay, there we go. Right, yeah. Thank you very much. The Councilmember Rice is certainly the best auctioneer on the county council. I'm
No
sure about
question.
that. I would, couple questions. Really glad to see the numbers. And Dr. Gales, if I'm correct, you said you would send us the updated report on the test positivity in the next, very soon, right?
I'll try to take care of it after this, before the other call, to make sure I don't forget it.
Great. And I know Councilmember Rice and I, following the great work of Councilmember Navarro and Alvarez, are meeting with the African American Health Program, I think tomorrow, or so, to talk further about the what we need to do to ensure that some of the issues I raised last week around we get more tests out in the Black community in general. And you said that I'm happy to hear that the Latino community, they are getting access to testing, at least at equal rates of the white community and others. That is not the case in the Black community. Has that trend continued into this next set of data?
So the testing volume, I wouldn't necessarily match it directly to access. I would just say the test run, because there's a lot of factors within that. And to that, that's one of the, when we actually had a conversation with reps from AHP, and one of the zip codes that they expressed concern about was 20906, which is why we quickly went, to stand up an option there, and have been working to promote that through their different networks and communication. But the testing volume does hold true from our last conversation where those numbers stood.
Okay. All right. So that's obviously something we'll be talking about more with you and with them. And on the Doctor, this is maybe for Dr. Stoddard. I've been receiving some reports, and this is not new. We've seen this with noise complaints and other things in the past pre-COVID, that certain businesses are getting targeted more for activity that others are doing. I know the truth is probably somewhere in the middle on that. Could you talk to me and send a report of, I don't know where this is available, of who is getting cited and where you're going and how all that's happening, because I'm getting more concerns from business owners and from residents on both sides of the issue, wanting people to be enforcement, but also saying that they think that there's disparate enforcement. So could you address that?
So certainly we can provide data about where we've gone and who we've talked to, and who's been doing things well and where we've had to issue citations. But obviously at this point, everything that we are doing is complaint driven. So let me rephrase that, because that's not actually accurate. So as far as education, we're educating pretty broadly across the county. We're doing outreach to say, here are the rules, here are the things. When it comes to enforcement, which is where we've heard about a complaint or are looking for, not looking for complaints, but, we've heard a complaint, we go out and we respond and we inspect and we find what we find. And so I have to look, we obviously have where complaints are coming in, and we can provide that information too. And so obviously in the targeting of businesses, as it were, obviously places where there is a density of more businesses in an area that have had complaints, we're naturally going to go to hit a number of businesses when we go out, instead of going out to this one and this one over here. And so I would certainly think that there is a trend that the areas that have a greater density of businesses are likely to see more enforcement, because there's a greater density of complaints in one area, and we're going to be responding to it. We've been very concerned about the equity issues from the beginning, though, because I think obviously we could talk about this certainly more. I did not think it was appropriate that we be targeting, Silver Spring disproportionately relative to Gaithersburg or to Poolsville. And so we've been very conscious of that from the beginning and incorporating that in. But obviously,
right. If you get a call,
go, right?
You got to go. And I don't expect you, and I don't think the public expects you to self-correct for bias that's in our society when people call, but we do need to be aware of it and try and look at the numbers and make sure that we're, it's not overrepresented, and we do what we can, and maybe it's more of an education activity as opposed to enforcement activity in some of those cases. So, and I know you're doing that, but I think seeing the numbers would be helpful, and I appreciate that context. Thank you for all that you all are doing. I'll look for the reports, and I'm glad we're heading in the right direction in the midst of a sea of not heading in the right direction other places. Thank you.
Thank you. Councilmember Arbonaz.
Thank you. I appreciate you guys are meeting with the independent schools this afternoon. One of the tools that they are utilizing, and a number of businesses are as well, to justify moving forward with plans to reopen, is taking people's temperature every morning and having that as a safety protocol. Certainly has value, but isn't it true, Dr. Gales, that people who are asymptomatic may not actually have a fever, but may have the virus? And so while it's one of many steps we need to take, it's probably not the panacea that on some level some people are making it out to be. Is that correct?
That is very correct. And actually part of what we're hoping to accomplish in hearing from the different schools in terms of what types of strategies that they are discussing, exploring, putting into place. Our goal is to listen and get feedback, but yeah, you're right. So temperature checks is not the end all be all, because in fact, we know that there are a percentage, and in fact, we've seen even in some of our different organizations and entities where individuals where temperature checks have been in place, they've been asymptomatic, they've cleared, but they have been discovered to be positive and have in fact put others at risk because they were afebrile and asymptomatic but still had the virus.
And the other issue is, of course, the schools can do everything they can to control the school environment, but they have no control over what happens when those kids go home and whether or not their families are adhering to the guidelines and policies. So that's why it complicates things. And it's a tough situation because obviously independent schools are in a better position than most because they already have smaller classroom sizes. And understandably, there's an anxiousness and a concern that we all have to balance the social and emotional impacts of students, but recognizing those logistical challenges. And so I would love to hear back from you what the report out is of your conversations with those independent schools. If you could please email us later tonight or tomorrow what the outcome was with recommendations, what next steps are, that would be great. And what hasn't been clear, I know we've asked, but is what authority do we have? Do we have the authority? You as public health, us as Board of Health, or is it the governor's call in making the decision? That I think is obviously relevant here too. So that would be helpful. Final thing for me is, and so appreciate Dr. Gales. I know we're making progress in a lot of areas. I think the statistic that triggered the concern a few weeks ago within the Latino community, which you shared with us because you were concerned about what it showed, was that although the overall numbers are going down and the average number of cases have dropped to, then it was almost 50, I think it's up a little bit higher now per day, it was the percentage of those people testing positive, even within that 50 or 60, that seemed to be so disproportionately high. And so if you could please continue to include that chart, acknowledging Councilmember Jawando's point about the level of testing, it's still a very important data point and should be included in the charts that you're going to be sharing with us across the board. And final thing is, appreciate the comment with regards to aquatics. A lot of frustration in the sports community over confusion over why soccer is in phase 3 instead of phase 2. And so I think there's probably some more that we need to do in that space. And I know you've already done a lot, but there's a referral on the sports link to the state. And sometimes the language and the semantics are different, saying the same thing, but in a different way. And that's confusing people. So I do think that that's something that we're going to need to think about moving forward in terms of clarifying that language. That I think would be helpful to a number of different organizations. But with that, I'll yield back my time. Thank you, Mr. President.
Thank you very much. Councilmember Glass.
Thank you, Mr. President. Thank you, Drs. Gale and Stoddard. I was going through my inbox during the start of this conversation, seeing what I've received a voluminous amount of correspondence on, and pools was definitely top of that list. And so I appreciate you starting the conversation with that. And then also a lot of social media talk with concerns about the testing turnaround, and appreciate that being asked earlier. And so there's just two other issues I have a question about. things that I have, concerns I've received, particularly from the LGBTQ plus community with regard to the testing, and when individuals are going to sign up for being tested, there are binary choices for gender expression. And here in the state of Maryland, we have driver's licenses that have a third unspecified other option. And they're asking if that third option that's on the driver's license can also be listed for the testing. Do either of you or Dr. Gales, do you have any thoughts on how we remedy this?
So we did bring that up with the laboratory, because the platform that you're speaking about is on the laboratory side. It's not the county side. And so we're asking and trying to work with them to correct it, because it's a part of their software. Because we do everything you said, endorse and support 150%. And so we are actively working to try to figure out if it's possible to change it on their end, recognizing everything that you mentioned.
Okay, I appreciate that. Good to know that that we on the council or we on the county are doing everything that we can. Mm-hmm. It's just the private sector partnership that doesn't have that software. Okay, and then the only other question I have is last week, I think it was last week, Dr. Gales, you and your colleagues from some of the major Maryland jurisdictions wrote to the governor and asked the governor to revise some of the activities listed under the phase 2. I'm curious what response you and your colleagues have received. You're smiling there.
So I do want to just clarify, the communication that we sent was actually to Deputy Secretary Phillips to convey that to the governor in their conversations. And so the response, we enjoy a great working relationship with Deputy Secretary Phillips and the staff at MDH. I know that those concerns have been shared with the governor's office. I think as best as I can share with you in terms of the response, I think is evident by what the governor has stated or not stated in the last week or so since we put that information up. My understanding is that he has a press conference this afternoon that he may be addressing the increase in numbers across the state. We remain committed from the public health sector, from the health officers, that we recognize that there are differences within jurisdictions, that, there may be some tweaks and nuances, but there are also some overall strategies that could be adopted at the state level. When we were thinking, we actually were having a conversation related to travel restrictions, talking about other jurisdictions. But when you look at the state of Maryland, there are some hot spots that are concerning. For example, Ocean City, where I believe it is suggested and recommended that you wear a face covering, but it's not required. And so I think there are some steps that could be taken on a state level with state leadership to address that would be beneficial and helpful to us as local communities, recognizing that people move back and forth across the boundaries and borders.
Well, go ahead, Dr. Stoddard.
I would really like to add to this. I think both Dr. Gales and I smiled because both of us on a call earlier today expressed some more colorful language to describe our displeasure with what's going on at both the national and state level. National leadership matters, state leadership matters, and I know it's not a popular thing to recognize when things aren't going as well as you would like them to, but and we've talked about what restrictions we can put in place in Montgomery County. But we're not an island, and so our ability to limit what happens when our residents visit neighboring jurisdictions to our own, or certainly Ocean City and other places, is limited. And having seen, I actually was over the weekend visiting family on the Delaware shore, and following all the rules. We didn't go anywhere, but just driving, you can see just the total lack of compliance around distancing and enforcement all along the Delaware shore and elsewhere. So, this is a huge problem. We need the governor to step up and take leadership. As Dr. Yels already said, we're talking about it, what we can do at a county level, but we can't do all that we think is necessary.
National leadership matters and state leadership matters. Thank you very much, both of you.
Thank you. Vice President Hucker.
Funny, Councilmember Glass repeated that. I was just going to repeat that as well. That is a pithier version of what I often say. So thank you, Dr. Stoddard. I might steal that without attribution. Dr. Gales, thank you for all your work, and looking forward to getting their updated numbers as well. Dr. Stoddard, several points. One is I totally agree we should not be driven by what's allowed in other states, and I'm glad that that is your North Star and has been since the beginning, and I think all of us support not wavering from that. Two, thanks a lot to you and your staff and Dr. Crowell and his HHS staff and the Red Cross and the Test Center for the response to the fire on Carroll Avenue. I haven't talked to you all. I've been in touch with Dr. Crowell. I've shared an update about it, but I really feel like your response was thoughtful, was thorough, and it was multi-layered, and it was thoughtful and thorough, and I really appreciate that. And I'm really glad to hear about the enhanced enforcement on the construction sites. We've heard many complaints for a long time. It seemed like a gap that was needed to be addressed. I do hope you'll keep in touch with us about who are the owners of those construction sites, because many of them are either county sites or county contractors or utilities that we deal with quite a bit. And if they're not complying immediately to your directives, we would want to know that. And obviously it dovetails with the enhanced effort to protect our Latino residents that was spearheaded by council members Navarro and Albornoz. So I think it's a really welcome initiative, and I'm eager to hear how that goes. Thank you, Mr. President.
Thank you. Council Member Navarro.
Thank you, Mr. President, and thank you so much, Dr. Stoddard and Dr. Gales. Really appreciate everything you're doing. I think that I'm very pleased with the direction that we are taking regarding addressing those disparities in our Latino community, in our Black community. I'm very excited about this model, and I really look forward to seeing how it's going to be implemented. I think it's one that we could definitely keep going because it really is comprehensive. So I've heard a lot of the micro issues, which is what we are elected to track. And I wanted to take a step back for a second and just get your reaction, generally speaking, on, where we're headed. In March, I remember us having conversations about, hey, maybe in June, we'll be ready to do X, Y, and Z, thinking that this virus would kind of, get through its life and it would be we'll be ready in the summer to do certain things. Right now, as we track national news, we see the hot spots, just describing how even within our state, we have particular hot spots, trying to convince everybody not to have restriction fatigue and that there's a reason for that. But have you had any time in your busy, your busy schedules to just kind of take a step back and think through where exactly are we headed here? Some tech companies have told, I know my daughter, for example, they've already said, hey, you're going to be working, remotely until next year. Both my daughters, et cetera. And so I feel like there is, we're so busy working on the micro level, but I wonder if you have had any time to reflect on perhaps what's at stake, where are we headed, because this has an impact on our financial, situation, our economy, but also it's kind of a sobering message for those who starting to feel a bit of, restriction fatigue, et cetera, that look, we got to stick with this, we got to stick with this. Any thoughts that you can express on that?
You're right. It's a sobering reality, and it is a sobering frustration because we had hoped that we would turn this around. And so many jurisdictions had turned this around to, if you think back to 3 weeks ago, the tone of our conversation was, well, when are we going to get to phase 3? Are we at 14 days? We're counting down, and no one's talking about that now. Because I think the reality is that we have a large amount of work to be done. For the folks who are at home with restriction fatigue, you got to hang in there, because if you let up, we're going to become one of those 20 to 25 hot spots that are seeing significant increases. We've already seen an uptick. I don't want us to become the exponential curve and compare it to that. So I think the reality is we're going to be at this for a lot longer. I think the provisions that we put into place, face coverings, things like that, teleworking and promoting those policies is going to become our baseline for the foreseeable future. And that is also in the setting of, some potential advances, not potential, but upcoming advances from a biomedical perspective in terms of vaccines and other treatments. So not all hope is lost. It's just we've got to tough this, stay the course. And, in Montgomery County, we've been able to see the improvements because residents have adhered to it. We've got higher adherence in terms of face coverings, folks sticking close to home and not going out. And we've just got to continue to do that. So, because even in the setting of these increases in other parts of the state, we have plateaued. And so you're right. We're talking about a shift of maybe 10 cases on average to where other places are seeing their numbers double in the same time setting. So we got to just continue. It's not over. And there's going to be lots of frustration because we had hoped to be in a different place, but unfortunately we're not there and we can't let up now.
I would only add that I appreciate the question very much. I mean, we've received a lot of questions about why we're doing a recovery framework while we're responding to the event. And I think it's really to your point, which is that there's going to be a period where this evolves into something else. There's going to be an after period, and we have to be thinking long term about what that means for our community and how we start to lay the groundwork for how we are better after this is over with. And there's a lot of work groups that we're not talking a whole lot about because it's not the thing that's right in front of our face. But when we talk about service access and other issues like that, those are long-term issues that we need to make sure are better today, but better 6 months from now. And so certainly I think that's, I think we're there loud and clear. Obviously, I think we all wish we had more time to do strategic thinking. I think everyone wishes that, but it is something that we think about with some regularity. We don't talk about it as much because obviously it's not the thing that's most current, but it's certainly something that we've built into our systems to allow us to do.
Thank you. And the last speaker today, and it's a 228.52, so we're almost under the mark, is Councilmember Friedson.
I'm going to try my best to be under the 230 mark, or at least close to it. So I'm going to come in way under budget, but most of my questions have already been asked. I really appreciate Councilmember Navarro's question. I was going to ask a global type question of that, so I won't repeat it. But I did also want to note, as has kind of been the theme here, we spend a lot of time in these briefings expressing frustration because people in the community are suffering. And the suffering has not been felt equally or equitably. And all of us share in that frustration. I don't think any of us hold it to ourselves. And it's come out, and that's our job. And I think that the public has a right to see us having these uncomfortable and critical conversations. It hasn't always been perfect, and I haven't always agreed with the decisions, or sometimes haven't even understood the decisions. But we are in a better place than most. And we have gotten to a place where we are targeting solutions to targeted communities that require that type of effort. We need to do more, and there's more to do. But I just wanted to thank you. I mean, I think, we are where we are in terms of where the state is and where we were before. We are where we are in terms of where the country is in so many places. It's thanks to your leadership, Dr. Gales and Dr. Stoddard largely. And we've tried to push and to ask and to poke and to try to drive us to a direction that actually addresses the issues. But, I do think that it doesn't often go said. Usually it's what isn't happening, not what is happening. And what is happening, while still hugely challenging and at times tragic, is better than most. And I didn't want to miss the opportunity to say that. We still have work to do, a lot of it, but I think we're at the place now where we can actually do that work together. It feels like we're pulling in the same direction. I think some of the fruits of your labor are being seen in terms of the tough decisions that you've had to make. We'll continue to ask the tough questions and continue to work with you, but I did just want to appreciate the work that you're doing and look forward to continuing the work that we need to do to get our community back to a place where it can be safe and doing activities as much as possible.
Thank you. Well said. And Councilmember Albornoz did point out that we should consider, and let me say we will, if this happens, leave open a calling of a special session of the Board of Health in case an emergency arises. So we, anymore, even if someone is away from their home, they can Zoom in. So we are here. We are your partner. We are appreciative. And we also know that you have other places to Zoom to. So thank you very much, and thank you for all that you're doing. Thanks.